Now, undigested meat fibers and fat, if it is found in the stool, what does it mean? Steatorrhea is there, doctor. That means there is a pancreatic insufficiency. Because pancreatic enzymes have lipase which will digest the fat inside the intestinal contents is what need to be fundamentally remembered. Now, coming to the thyroid function, it is the T3 level which will regulate the serum TSH primarily is what need to be remembered. Okay, doc, one very interesting question to all our NEETPG compliant warriors of the exam. What is that blot which identifies the DNA binding proteins like transcription factors which are used in labeling the, it is done by using the labeled oligonucleotide probes. You like to call southern blot or northern blot, eastern blot, western blot, northeastern, northwestern, southeastern, southwestern, so many things are there. Who will answer it correctly? Southern. Vijayawada student says southern. Dr. Chinna says southern. Varun says west. Dilip says west. Guntur says southern. What is your answer, doctor? Sandeep. That's the reason. If it is southern, northern, why will I ask on this wonderful evening? Southern blot is basically a DNA sample which is being identified. Northern blot is for RNA. Western blot is for the protein. You have a southwestern blot which need to be the new terminology, which identifies the DNA binding proteins like transcription factors using the labeled oligonucleotide probes is what you have to ultimately remember. But a very good attempt done by everybody. Now, doctor, what will growth hormone excess will lead to? Acromegalic individuals will have diabetes. So it leads to insulin resistance. Hypertension is the hallmark of pheochromocytoma. What is the action of insulin on potassium, doctor? It will drive the potassium from extra into intracellular environment is the job of insulin. That's the reason when a diabetic ketoacidosis patient is paraded to you, how will be his potassium levels, doctor, if you take a blood sample? Typically it will be normal. Why? Because potassium का घर कहाँ है? सेल के अंदर है उनका घर. It is a typical male chauvinistic theory. The place of the woman is inside the kitchen. Kind of a male chauvinistic piggish theory. Potassium's location is घर के अंदर, sodium का काम है बाहर. But who drives the potassium into the cell? It is insulin. If the insulin is deficient in DKA patients, potassium is not inside the cell, it is outside. But how is a DKA patient? He is vomiting. Every time he is vomiting, what is happening? His intravascular volume decreasing. Decreased intravascular volume, decreased blood flow to the kidney. That stimulates renin, angiotensin, aldosterone. Aldosterone, what will it do? Retains sodium and loses potassium into urine. And hence potassium is lost into urine. And his total body potassium is low. But how is his serum potassium? Even that low potassium, instead of inside being the cell, it is outside the cell. Hence if you take a serum sample, K plus value will be normal. But how do you treat decay? Total body potassium is low. But even that little potassium is remaining in the extracellular environment inside the serum. Hence serum potassium is normal. The moment you start treatment with saline and insulin, that little potassium will run into the cell and patient will go into hypokalemia once you start the treatment with the insulin and saline in decay. That's the reason when you are in casualty, when your decay patient comes, though his serum potassium at the at the time of arrival may be normal, but the moment you start insulin therapy, you must repeat the serum potassium after 3 to 4 hours. And if the serum potassium has come down, then that becomes an indication for administering IV potassium drip is what need to be fundamentally remembered. Now, if a substance enters renal artery and it is not seen in the renal vein, what does it basically mean? Typically, it means that its clearance is equal to renal plasma flow, that it is being totally secreted into the nephron. It is an indication, is what has to be understood. Now, depolarization is due to sodium. I think cheapest question in the entire paper. Okay, I hope nobody has yeah, now who is going to give me the answer? Loss of heterozygosity. Loss of heterozygosity is the genetic phenomena involved in the pathogenesis of which tumor? Yes, our Guntur students are very sharp in answering. We get a very proud answer. Retinoblastoma from everybody. Guntur has correctly answered. I think today we have some topper sitting in the classroom of the Guntur Center. Knutson's hypothesis is what need to be remembered. So the whole idea of taking a test, participating in discussion is all that spardhaya vardhate vidya. You need to compete, fight, envy and be driven to study more. That is the whole idea. So if a patient inherits and develops a mutation in a tumor suppressor gene, that is basically called retinoblastoma, is what need to be remembered. ApoB, where do you find it very abundantly? It is the part of the LDL. Remember, doctor, everything about lipoproteins and hyperlipoproteinemias. Today only you must go back home and study. Type 1 kya hai, type 2 kya hai, where do you find ApoB48, ApoB100, everything you must massage the entire concepts so that you are ready to fight any question in the tomorrow's exam. Fabries typically lead to the accumulation of the trihexosyl ceramide in the endothelial and the medial smooth muscles of the blood vessels, and that lead to typically renal infarction in the Fabry's disease. Now a 3-year-old female, mental retardation, seizures, pulmonary infiltrates and sphingomyelin accumulated means think of Niemann-Pick. In Gaucher's, it is a lysosomal storage disorder, as all of you know very well. That's right. Now in Tay-Sachs, it is a hexosaminidase deficiency. Now I want to shoot a question to you. Give me an answer, doctor. Both normal mutated mitochondrial DNA is there. I think some of our students expressed C or D for our earlier question. I think we will take up some doubt clarification at the end of the session. Okay, now doctor, both normal mutated mitochondrial DNA is there. What is this phenomena is basically called? Uniparental disomy or heteroplasmy or mosaicism or linkage disequilibrium. What is the term given for it? Any confident answer? Genetics is a vague, useless piece of crap which we don't care earlier, but not now. 20 questions anatomy means 3-4 questions genetics ka penko. The examiner can have a choice. Who will give me the answer? I expected. Dr. Padmaja said mosaicism. Heteroplasmy is an answer we get from Warangal, Vizag, Guntur and also from Sandeep. Generally while framing questions I guess what is the most possible wrong answer. Right answer if you answer I am happy. Okay. Let me clear some terms for you because often questions come on this area. if the offspring receives both the copies of the chromosome from one parent, for example, chromosome number 15, I am expected to get 115 from dad and 1 from mom. Ovum and sperm are expected to give me. But if I get both 15 from only dad, then that is called uniparental disomy and that is abnormal. Right? Now, what is mosaicism? Cells in the body differ in their genetic makeup because of the post-fertilization loss of the genetic information during the mitosis, which is basically called as mosaicism. Then what is linkage disequilibrium? Certain alleles at the two linked loci occur together more often than by chance. Then that is basically called linkage disequilibrium. Of course, say you are in love with somebody, you will go and say that, oh, are you going in that direction? I am also coming in this direction. So it is not really you are going in that direction. So the genes also will talk to each other like that. There are two loci, not by chance, really by certain frequency, they both are going together. So a lot of times we think, elder brother got seat in medicine, second brother also got seat in medicine, what will third brother will do? He will open a medical shop, because that is more prosperous business to do when the other two brothers are doctors. Because a medical shop guy earns more money than the brothers. Because the first two brothers have those genetic loci which travel together. But the third brother's genetic locus travel towards pharmaceutical shop. So there is a difference. Linkage disequilibrium. But the correct answer will be heteroplasmy is the definition of both normal and mutated mitochondrial DNA resulting in a variable expression. So that since mitochondrial DNA mutation is there, you expect a very severe problem in the muscles of the person. But the clinical expression is very mild. The reason is all cells don't have mutated mitochondrial DNA. There are some normal, some mutated mitochondrial DNA together. Hence the clinical severity became lesser, which is basically called the heteroplasmy. Very few people answered it correctly, but anyway, I am very sure you will appreciate this in tomorrow's exam. Transketolase, thiamine, you should not forget. Alport syndrome and type 4 collagen, you all know very well. Catalase destroys the hydrogen peroxide. For the action of ADH, you basically require cyclic adenosine monophosphates. CAMP is the secondary messenger. For the estradiol, from where are they derived from? It is the aromatization of the androgen testosterone which lead to the development of the estrogen, is what you have to fundamentally remember.